In this session, we are going to see detailed account of anatomical features of deltoid muscles. In previous session, we have covered other muscles which are going to be related with scapular region, and along with those muscles we have seen trapezius also. Now we are going to see another important muscle related to the same region, that is deltoid muscle, which is a very important muscle to see. So this muscle you might have heard somewhere like clinical areas, that is a muscle which is used for intramuscular injection. So this is a muscle which is seen in the lateral area, which is covering the shoulder joint. The large mass of muscle which you are seeing here is deltoid muscle. So the muscle which you are seeing here is right deltoid muscle, and this muscle, it is going to take origin in three ways, that is from two bones, from anteriorly clavicle and posteriorly from scapula. But from scapula we will be having two important areas which is giving origin for this muscle. So altogether we have three origins for this deltoid muscle. So those three origins are coming and forming the lump or mass of this muscle, and later it is getting inserted into the arm bone, that is humerus. In humerus we will be having lateral surface, and in the lateral surface middle part we will be having a tuberosity called deltoid tuberosity, and in that deltoid tuberosity we will be having insertion of this particular muscle. So origin by three ways and insertion into the one bone, that is humerus. Now we will go into the details. Here you can see this is a 3D view. So the other muscles seen in the arm are removed, such as biceps and triceps and all. Now you are seeing only the deltoid muscle, and the muscle which is taking origin from the anterior part, that is from the clavicular region. So it is taking origin from the anterior surface and superior surface of lateral 1/3 of clavicle. Here you can see clearly. So this is clavicle, from the clavicle lateral 1/3, anterior surface and superior surface, giving origin for anterior fibers of this deltoid muscle. Then we have another two parts of deltoid muscle, that is middle part and posterior part. This middle part, it is taking origin from scapula's acromion process. You know we have three processes happening in scapula. Those are spinous process, acromion process and coracoid process. So now the middle fibers are taking origin from lateral border of acromion process. So this is the part which you are seeing, which we will call as middle fibers of deltoid muscle. Then we have posterior fibers. So posterior muscle fibers which you are seeing here, that is taking origin from spinous process of scapula. So from the spinous process of scapula we will be having this posterior fibers taking origin from the lower lip. So in spinous process we will be having two lips, that is upper lip and lower lip. Lower lip is responsible for the origin of posterior fibers of deltoid muscle. So here you can view that clearly. After removing trapezius muscle, supraspinatus and infraspinatus, you can see scapula clearly. So this scapula posterior surface will be having spinous process. That spinous process lower lip, it is giving origin for posterior fibers, and here if you are seeing we will be having middle fibers taking origin from the acromion process lateral lip. I think it is clear to you. So this is lateral lip of acromion process, that is giving origin for middle fibers, and here you have clavicle lateral 1/3 giving origin for anterior fibers from the anterior surface and the superior surface of this particular bone. So that's all about the origin of this deltoid muscle. Now we have humerus bone here, right? So this humerus middle part lateral surface, it is giving insertion for this muscle. So here we will be having deltoid tuberosity in the middle, and that is giving insertion for this deltoid muscle. So now we are going to see a detailed account of deltoid and shoulder regions. And now about deltoid muscle, as we discussed earlier, we are going to see about its origin, insertion and its importance, along with nerve supply and its action. So talking about the origin of deltoid muscle, first we have clavicle. So in clavicle you can make out the red color demarcation in the lateral 1/3. In both we have, this is superior view, this is inferior view. In superior view you can make out this as anterior part. So in the lateral 1/3, anterior margin and the superior surface giving origin for deltoid muscle, and in this inferior part you can see a small portion that is also from anterior area, that is also giving origin for this deltoid muscle. Now we will move on to next bone, that is scapula, which you already know. And here what they shown is, in first picture we have supraspinous fossa, and second picture they have infraspinous fossa, and the whole both the things are indicating posterior view of scapula. And now this is humerus. In humerus lateral part you will be having a tuberosity, and that tuberosity will be called as deltoid tuberosity, which is seen in the middle part of the humerus. And now going into the details of this muscle. So about deltoid muscle, so here you can see the red color demarcation indicating the origin of deltoid muscle. So here you can make out spinous process lower lip and lateral lip of scapula, that is acromion process. So we have lower lip of spinous process along with lateral lip of or lateral border of acromion process along with superior surface of lateral 1/3 of the clavicle giving origin for this deltoid muscle. And here you can see blue color demarcation which is indicating the insertion, and that point we will call as deltoid tuberosity. And then we will be having another picture which will showing the origin and insertion clearly, that is here you can make out the deltoid muscle on the whole, and this is the spinous process, acromion process and clavicle, from where this muscle is taking origin by three ways, and anterior fibers, middle fibers and posterior fibers we will divide, and all these fibers converge together to get inserted into the deltoid tuberosity, which is seen in the middle part of the humerus, and this part is called as deltoid tuberosity. And here we will be getting insertion of this particular muscle, and this is the way how the deltoid muscle is arranged. So it is an example for multipinnate muscle, and here you can make out some septas happening. So these four septas are arising from four tubercles of acromion process, and here we will be having three septas arising from the deltoid tuberosity of the humerus, which is forming the muscle converge together fibers to form a multipinnate appearance. And now about the details. Origin, as you already know, we are dividing into anterior, middle and posterior fibers. Anterior fibers, it is arising from anterior border of lateral 1/3 of clavicle, and middle fibers from lateral border of acromion process, and which is in multipinnate muscle as I said now. And then we will be having posterior fibers, that is arising from lower lip of crest of the spine or spinous process. From the lower lip of spinous process is enough, and so we will be having origin in this way, anterior, middle and posterior fiber. Now we have insertion that is happening in humerus middle part, which we will be having deltoid tuberosity. And coming for the picture here, so here a cadaveric view can make out, here muscle fibers are seen clearly, this is deltoid muscle. And now we will go into the details of nerve supply. Nerve supply of this deltoid muscle is by axillary nerve. You know, it is a nerve coming from brachial plexus, and it is related to axillar region, and it is going to be related to the surgical neck. Okay, so from there it is going to supply this deltoid muscle. This nerve is just going to carry C5 and C6 spinal fibers along with it, and then we will be having action of these fibers. So middle fiber, it is a powerful abductor of shoulder joint, and coming for anterior fibers, it is going to cause flexion along with medial rotation of the shoulder joint. And then we have posterior fibers, which is going to cause extension and lateral rotation of shoulder joint. I will repeat it. Anterior fibers for flexion and medial rotation of shoulder joint. Posterior fibers opposite action, that is extension and lateral rotation of shoulder joint. And middle fibers, it is going to form a powerful abductor of the shoulder joint. And now we will be having some applied aspects for this muscle. As I said before, it is a muscle where intramuscular injection is happening. So intramuscular injection is given in the lower half of this deltoid muscle, and this deltoid muscle is tested by abducting the arm against the resistance. And then we will be having a sign called Dobbin's sign, where pain on palpation below the acromion process in subacromial bursitis. It disappears when the arm is abducted. Dobbin's sign is nothing but a pain on palpation below the acromion process, which and all you know, in the subacromial bursitis. It disappears when the arm is abducted. and we'll be having many structures under cover the deltoid muscle. Those structures are, we'll be having bones, muscles, and then we'll be having some ligaments, nerves, vessels and all. Those things we are going to deal now. Bones are upper end of humerus and coracoid process. Here in this picture it is clear. We will be having upper end of humerus along with coracoid process, which is covered by deltoid muscle, and then we will be having muscles such as coracobrachialis, which is taking origin from the coracoid process, along with short head of biceps, which is also taking origin from this coracoid process, and then we will be having long head of biceps and also triceps, which is taking origin from glenoid cavity from upper and lower tubercles, and then we will be having lateral head of triceps also getting merged by the cover of this deltoid muscle. And then we will be having other muscles such as pectoralis major, minor, teres major and minor, latissimus dorsi, subscapularis, supraspinatus and infraspinatus muscle, and all these muscles are getting covered by this mass of muscle called deltoid, which you have to remember. So bones only two in number, one is humerus, another one is coracoid process. Muscles are the origin of muscles such as coracobrachialis, short and long head of biceps, long and lateral head of triceps. Insertion of muscles such as pectoralis major and minor, teres major and minor, latissimus dorsi, subscapularis, supraspinatus and infraspinatus. And vessels which are going to covered by deltoid muscle are anterior and posterior circumflex humeral vessels, and nerve is axillary nerve. The joint getting covered is shoulder joint along with its ligaments, along with coracoacromial ligament also, and a bursa which is submerged is subacromial bursa, which we have seen now in Darboun's sign. And these all about the details of deltoid muscle, and this deltoid muscle can be easily illustrated in a line diagram, which I will show you now. And here, so now we are going to see a simple picture or simple image of deltoid muscle, how it is seen in our body. So here you can make out a bone called clavicle, and here we will be having acromion process, and here we will be having spinous process. So this is considered as lower lip of spinous process, and this will be considered as lateral border of acromion process. And this diagram is a simple picture to understand in a simple way. So here origin, so this deltoid muscle, it is taking origin from the, we are going to see the origin and insertion of deltoid muscle in a simple line diagram. So here in this picture you can make out three bones, such as anteriorly you will be having clavicle, and posteriorly we will be having two process of scapula, that is acromion process and spinous process. Here you can make out lower lip of spinous process, and this is considered as lateral border of acromion process. And the bone which is present here in the lower part we will call as humerus. In the middle of or shaft of humerus we will be having a tuberosity, which we will call as deltoid tuberosity. So now we are going to deal with the muscle fibers. So it is having three fibers, right? That is anterior, middle and posterior fiber. So now anterior fiber of this deltoid muscle are taking origin from the anterior surface and superior surface of the clavicle. From the lateral 1/3 of clavicle we will be having fibers of anterior fibers of the deltoid muscle taking origin. So the muscle part which you are seeing here is anterior fibers of the deltoid muscle, and then we will be having middle fibers taking origin from lateral border of the acromion process. So here we have acromion process, lateral border, it is giving origin for this middle fibers of the deltoid muscle, and then we will be having posterior part, that is lower lip of spinous process, it is again giving origin for posterior fibers of the deltoid muscle. So in this way we will be having origin, and then insertion, it is happening in the deltoid tuberosity. Here you can make out the deltoid tuberosity, which is a part of humerus giving insertion for this deltoid muscle. Here one more thing which you have to remember is we will be having some septas arising. Those septas are from the tubercles of acromion process. Here we might have four tubercles happening in the acromion process. From the four tubercles we will be having four septas arising, which is going downwards. So these are the 4 septa arising from the acromion process, and same way from the deltoid tuberosity we will be getting 3 septa arising and going upwards between these 4 septa coming from acromion fibers. These septa which is going to give the muscle fibers convergence. So middle fibers are going to converge in such a way by having multipinnate appearance. So in this way it is going to converge, which is going to converge and form a multipinnate appearance. So in this way it is going to insert its fibers. So this is the way of insertion and origin of deltoid muscle, and the way of arrangement is making the muscle multipinnate, or example of a multipinnate muscle. So that's all about the origin and insertion of this deltoid muscle. And about the things or about the structures covered by deltoid muscles is also equally important, along with the origin, insertion, nerve supply and the action of this muscle. Now we will move on to shoulder region, specific areas or spaces present related to the shoulder region, that is we'll be having quadrangular and triangular spaces which is seen posteriorly. So about deltoid muscle, I think you people are thorough. Now we will move on to our next topic. Now we are going to see about the shoulder region posterior part. So the view what you are seeing here is posterior surface of shoulder region. Here you can make out some spaces present between the muscles. So these spaces are called as intramuscular spaces. 3 spaces will be noted here. One is upper triangular space, another one which is diagonal or opposite, that is lower triangular space. Above these two we will be having one space which is wider, that we will call as quadrangular space. All these muscles are present between the muscles, so we will call as intramuscular spaces. About intramuscular spaces, so here this is a cadaveric view where shoulder is abducted, and here you can see clearly we will be having 2 triangular spaces along with a quadrangular space. So this is upper triangular space and this is lower triangular space, and this is called as quadrangular space. The muscle related to these are, one is teres minor, which is going above from the lateral border of the scapula to the greater tubercle, and then we will be having teres major again from the lower part of the lateral border of scapula, and then it is going to insert in the intertubercular sulcus lip, that is on the medial lip of bicipital groove. And then we will be having another important muscle present here, and that muscle is called as long head of triceps. Here you can make out, and again you will be having one bony part that we will call as humerus bone. So this is humerus, teres minor, teres major along with long head of triceps. And then for moving into details, the spaces around the scapular region, first we will see quadrangular space. The quadrangular space, it is bounded like superiorly we will be having subscapularis and capsule of shoulder joint along with teres minor, and inferiorly we will be having teres major muscle. Then we will be having medial part related to long head of triceps, lateral part related to surgical neck of humerus. And then the structures or contents present in the spaces are axillary nerve. So as surgical neck of humerus is related, we will be having a nerve which is related close to this neck, that is axillary nerve, and axillary nerve always will be accompanied by posterior circumflex humeral vessels. So these are the 2 contents seen in the intramuscular spaces. So now we will move on to another space, that is triangular spaces. So we have 2 triangular spaces remaining. Those are, we will be having now what we seen as quadrangular space. You can make out here clearly, that is above teres minor, teres major, surgical neck of humerus, and laterally we will be having long head of triceps along with 2 contents such as axillary nerve and posterior circumflex humeral vessels. Now we will move on to our next topic, that is upper triangular space, and this space again it is bounded above by medially by teres minor and laterally by long head of triceps, and inferiorly it is bounded by teres major. Medially teres minor, laterally long head of triceps, and inferiorly by teres major, and then we will be having contents as vessels only. So those vessels are circumflex scapular vessels. So here you can make out, so this is upper triangular space. You can see clearly above So here medially it is bounded by teres minor, laterally by long head of triceps, and inferiorly by teres major. The content is circumflex scapular vessels. So now we will move on to next topic, that is lower triangular space, and it is bounded again medially by long head of triceps and laterally by shaft of humerus and superiorly by teres major. Coming to contents of this lower triangular space, it is having a radial nerve and a vessel called profunda brachii vessels. As we said, in quadrangular space we will be having axillary nerve along with posterior circumflex scapular vessels, humeral vessels. Here also one nerve always will be passing along with a vessel, that is radial nerve, always accompanied by profunda brachii vessels. So these are the contents and boundaries of spaces related to shoulder region. Here you can make out clearly. So here this is called as lower triangular space. You can see we will be having medial boundary and lateral boundary. So this is medial boundary formed by shaft of humerus, lateral boundary by long head of triceps, and superior boundary formed by teres major. And then we will be having contents such as radial nerve along with profunda brachii vessels. Radial nerve, you know, it is a branch of brachial plexus. So now talking about axillary nerve, because axillary nerve is the nerve which is going to supply the deltoid muscle. So it is also called as circumflex nerve, and it is a branch of posterior cord of brachial plexus, as you already know. And then we will be having root value for this nerve is C5 and C6. Coming to course of this axillary nerve, in the axilla it is traveling first from coming from brachial plexus, it is going to reach the axilla, later it is going to reach the quadrangular space, then after it is going to reach the arm region. Here you can make out clearly. So this is axillary nerve. From axilla it is winding and coming to the quadrangular space which is present behind, then after it is going to the arm region to supply. Then we will be having branches and distribution of this nerve. One will be muscular branches, that is to the muscles such as deltoid, and then we will be having cutaneous branches to supply the skin over the muscle, and articular branches to the shoulder joint, and then we will be having vascular branches which is going to supply circumflex humeral vessels, and then we will be having some applied aspect for this nerve, such as injury to axillary nerve will be happen due to dislocation of shoulder joint, or sometimes at surgical neck of humerus if any dislocation happened or fracture happened, that is also will cause injury to axillary nerve. So the applied aspect which you have to remember is it may be caused by dislocation of shoulder joint, one point, and then it may be due to fracture in the surgical neck of humerus, and this will lead to loss of abduction. So abduction of arm cannot be happen, and loss of shoulder contour. You will be having some shape in the shoulder region. The shape will be lost because deltoid muscle which is going to give this contour is going to lose its nerve supply by axillary nerve. And then sensory loss over the lower half of the deltoid is the most commonly occurring due to the lack of axillary nerve. And then you have to remember we'll be having an important topic related to shoulder joint, that is anastomosis, which is happening around the scapula. So this anastomosis will be happening in two areas. One is in the body of the scapula, and the one is in the acromion process of the scapula. So in the body of scapula it occurs in three fossas. So it is between the branches of first part of subclavian and also from third part of axillary artery, and suprascapular artery that is responsible for this anastomosis in body of scapula. You have to remember we have three arteries which is going to give anastomosis in the body of scapula. Those are suprascapular artery, transverse cervical artery, and circumflex scapular artery. And here suprascapular artery is a branch of thyrocervical trunk, transverse cervical artery is a branch of thyrocervical artery, and then we will be having circumflex scapular artery, which is seen in the upper triangular space, is a branch of subscapular artery. So these are the three arteries going to get anastomos in the body of the scapula. So that is in the supraspinous fossa, infraspinous fossa, and also in the subscapular fossa. So here you can make out. So this is the anterior view. In anterior view what you are seeing is subscapular fossa, and the artery what they are shown is subclavian artery, and here what you have is axillary artery also. So this is subclavian artery, which is going to continue as axillary artery. First part, second part and third part of the artery are seen here. So here these arteries branches are going to get anastomosed in the anterior surface of body of the scapula, and some branches will go to the posterior surface where it will anastomose in the supraspinous and infraspinous fossa. And here you can see the posterior view where supraspinous and infraspinous fossa also will be having this anastomosis. And then we will be having anastomosis over the acromion process, that is formed by acromial branch of thoracoacromial artery, suprascapular artery and posterior circumflex artery. And anastomosis around the scapular region is going to provide collateral circulation to the upper limb. When the distal part of subclavian artery or sometimes proximal part of axillary artery is blocked, this anastomosis will give alternate channel for the blood supply of the axilla in the axilla and the scapular region. So now we are going to see scapular anastomosis in a simple way. So here we are going to see the anastomosis happening in the body of scapula first. So it is caused by, or it is formed by, three arteries and by major two arteries, such as we will be having branches arising from axillary artery and subclavian artery, which is going to anastomose with each other, and that is going to form scapular anastomosis in body. So those arteries are, we will be having suprascapular artery and deep branch of transverse cervical artery, branches coming from thyrocervical trunk of subclavian artery, and then we will be having circumflex scapular artery, which is a branch coming from third part of axillary artery, are going to anastomose. So here in this diagram you can see clearly this as a subclavian artery. So till this we are having subclavian artery, and which is going to continue as axillary artery. In axillary artery again we will divide into three parts, first, second and third part, and from third part we will be having arteries arising, that is going to get anastomosis. So first we will take subclavian artery. In subclavian artery also we will have three parts, and those three parts will be having branches which we will deal later. Now you remember we will be having one branch called thyrocervical trunk. So this artery, which we will call as thyrocervical trunk, and this thyrocervical trunk, it is giving two major branches for this anastomosis. One is suprascapular artery, another one is deep branch of cervical artery. Okay, deep branch of transverse cervical artery, and then we will be having another branch coming from the same artery, which we will call as suprascapular artery. So this is giving many branches near to the body of scapula. Here what you are seeing is posterior surface of the scapula, and here you can see many arteries giving, many branches are given by this deep branch of transverse cervical artery, which is again a branch of thyrocervical trunk. And again we will be having another artery arising from this thyrocervical trunk, and that is suprascapular artery. So we will be having suprascapular artery, which is again a branch of thyrocervical trunk, which is going to contribute for this anastomosis. So we have two arteries coming from subclavian arteries branch called thyrocervical trunk, and this artery is named as deep branch of transverse cervical artery. So deep branch of transverse cervical artery and suprascapular artery, as it is passing on the superior border of scapula. Then we will be having another branch coming from third part of the axillary artery, which we will call as circumflex scapular artery. So this circumflex scapular artery, it is going to give some branches which is getting anastomosis with this branch which is coming from subclavian artery. So this whole thing, it is going to get anastomosis in the body. Again we will be having some branches coming from all these branches to enter anastomose with each other. So we will be having some branches coming from suprascapular itself, it is getting anastomose with the deep branch of transverse cervical artery. So this is the anastomosis happening in the body of the scapula. Same way it will happen in the anterior aspect also in the subscapular fossa. So here what you are seeing is circumflex scapular artery, which is giving branches to anastomose with the branch of transverse cervical and the branch of suprascapular artery. So this is all about the anastomosis happening in the body of the scapula. Now we will talk about anastomosis happening in the acromion process. You know this as acromion process, and in this acromion process we will be having three arteries again getting anastomosis, and two branches are coming from axillary artery and one branch coming from subclavian artery. Here already we seen a branch coming from subclavian artery, that is suprascapular artery, that is giving one branch for the acromion process. And then we will be having another branch coming from the axillary artery second part, that is a branch from thoracoacromial artery. We have studied before, we will be having second part a branch given, and that branch we will call as thoracoacromial artery, and that branch, acromial branch of thoracoacromial artery, is getting anastomosed with the suprascapular artery. Along with, from third part we will be having posterior circumflex humeral artery. So that posterior circumflex humeral artery, it is also going to reach in the acromion process to get anastomosed with other two arteries. So in the acromion process we will be having three arteries getting anastomosis. One is by thoracoacromial artery, which is a branch coming from second part of axillary artery, and another branch we will call as posterior circumflex humeral artery, which is coming from third part of axillary artery, and another artery is suprascapular artery, which is coming from first part of subclavian, and that main branch is thyrocervical trunk, which is a branch of subclavian artery. In this way we will be having anastomosis of scapula occurring. So this is all about the anastomosis happening in body and in the acromion process.